Hi, hello friends. In this video, we shall read how to read a normal LS spine X-ray. So basically, first thing what we should see is whether the normal lumbar lordosis curve is maintained or not. Here it is looking fairly normal. So whenever there is some spasm, infection or inflammation, any reason which leads to spasm, then you can see a straightening of the curve. The normal lumbar lordosis is lost. So after the curvature, you should see the disc space, whether they are maintained or not. Sometimes when there is a disc prolapse or in advanced stages, the disc height can be reduced. Whether the vertebral body height is maintained or not, especially in the old patients, they come with sudden severe back pain. Then you need to check for any osteoporotic compression fractures or sometimes can be multiple myeloma. And you should also see for the end plate changes. It can be cox also. So you should compare one vertebra with the vertebra above and the below. So you should also check for any listhesis, because listhesis, it can be either anterior or retro. So you should compare the curvature both anterior and posterior. So sometimes the vertebra can slip forwards. So you should always check for the listhesis, and on inspection and on palpation you should check for the step. So these are the main important significant points which you need to see in the lateral view. So in the AP view, you should check for the pedicles, whether the pedicles are maintained or not. So before asking for the X-ray, you should know why you are asking. You should know the history of the patient, whether it's a normal back pain or is there any history of trauma and all. And again, the same things, you should check for the disc space, you should check for the vertebral body height, you should compare with the others, and you should see for the SI joints, whether they are looking normal or is there any lysis in the SI joint. And at the same time, you should always palpate the SI joint. You should see whether is there any sacroiliitis or not. So taking the history is equally important, like whether the pain is more in the evenings or whether the pain is more after forward bending or whether the pain is increasing after cough. So whether the pain is more in the forward bending or backward bending, should also see for any deficits. So examination is very important. So in addition to the X-ray findings.